My name is Dr. Meh, the Medical Director of the Richards Clinic. I really appreciate you for watching this lecture, and I thank every one of you who have been sending in questions, asking us to treat one topic or the other as concerns the joint and joint pain. And today, we are here to treat one of the questions someone among you asked us: what is actually the cause of pain, of arthritis? That was our topic today. What are the causes of arthritis? And before we go into that, I would like to let you understand that when we talk about arthritis, we don't just mean joint, the knee joint. Arthritis is a disease that affects all the mobile joints of the body, meaning that arthritis can affect the neck, it can affect the low back, it can affect the ankle, the elbow, the shoulder, the wrist, the knee, name it. As long as the mobile joint in the body, it can suffer arthritis. And the question now is, what causes this arthritis? The cause, we don't really call it the cause, because the cause of arthritis is not exactly known. But to call it predisposing factors, there are certain conditions that you may have that predisposes or puts you in a high chance to suffer arthritis. These are the things we are going to mention today, so that you watch out and see what you can do to prevent having this disease called arthritis. And in talking about the predisposing factors, some of them are natural conditions and some of them are artificial, meaning these are the things we bring up on ourselves. Those natural conditions, there's nothing you can do about them. And one of them is age. Yes, arthritis is a disease that affects every age group, from infancy to adulthood. But it is commoner in adults. Why? Because the tissues of the joints are not as malleable and soft and strong as when one is younger. So as we age, it becomes more brittle and fragile, that with any stress can crack them or lead to their destruction. That's what we call degeneration. And degeneration is actually arthritis. So it's not uncommon to see arthritis more in the elderly than in the young. Okay? It's also commoner in the females. In fact, some studies have come out to show that females are 2 times more exposed to arthritis than males. There are many reasons for that. The hormones, the way women are built, the physical build of women, and all that. We are going to treat that another day as a full topic. But know today that women are more predisposed to suffer arthritis compared to males. Arthritis is also known to have genetic predisposition, meaning that there's possibility that it can be inherited from the parents. Because a gene has been discovered, parents can transmit to their children, which will predispose them to arthritis. So if your parents suffered arthritis or are having arthritis, know that there is up to 40 to 65% chance that you might suffer arthritis with time. So knowing this will help you in what to do to prevent it. There's also an arthritis that is known as rheumatoid arthritis. It's a type of arthritis where, for a reason not really well understood, the body sees the tissues of the joint as foreign matter, as foreign objects that needs to be destroyed and cleared off the body. So the immune system of the body begins to attack the ligaments and the cartilages of the body and the other tissues of the joint. And that's what is known as rheumatoid arthritis. It affects majorly the small joints. Before you know it, it begins to deform the joints. It affects the big joint, the elbow, any part of the body. So these are conditions that are natural, that is not because of what we did or what we did not do that led to this kind of led to the arthritis. Now, going forward, we are going to look at certain conditions as a result of our negligence or not knowing that might predispose us to having arthritis. One of them is overweight. Okay, so there's what is called BMI, meaning body mass index. Your body mass index determines whether you are normal weight or overweight or even obese. So you can see written down here, this person is on less than 18, the BMI, that's underweight. 18 to 24.9 is normal weight, and this is where you should be targeting. And BMI is measured with your height and your weight. At a particular age, like 25 years or so, your height ceases. You don't grow more. What changes is your weight. So when your weight increases more than it's supposed to increase for your height, your BMI increases. Okay? So this person here is obese because his or her BMI is started at 34.9. This is what's called malignant obesity, which not only affects the joint but causes other health conditions like diabetes, hypertension, and all that. So your height is stable at a particular age, but your weight can vary, and that's what we have to work on. Because any kg, 1 kg increment in your normal weight, what's supposed to be your normal weight, puts about 4 kg stress on your joint, especially the knee joint. So these 3 people are jogging or walking. This person stress on the hip, the knee, and the ankle is more than this person. And this guy is good because her weight is what her weight should be for her height, meaning that her BMI will be around this range and no stress. Okay? Now, injury or trauma. Whenever our joint is injured, the ligaments, the cartilage, the tissues of the joint, they heal by a process known as repair on their own. When a tissue heals by repair, it does not heal 100% because it leaves a scar that weakens a particular spot in that tissue. So as time goes on with age, that person might come down with osteoarthritis of that joint. But if that wound was repaired by regeneration, which these ligaments and cartilages don't do on their own, or else you give them regenerative treatment, that tissue that heals with regeneration practically replaces itself with new tissues. There's no scar formation. In that case, that joint is restored back to normal. It's not like somebody who healed by repair. So this person that is treated like this, the pain will go, the ligament will heal. With time, this person might come down with osteoarthritis. If we have significant wound that got infected around our joint, that infection might get into the joint, affecting the ligaments, the cartilages, and other tissues of the joint. And that is what we call septic arthritis, arthritis due to infection. Even if that joint heals, that joint with time may come down with osteoarthritis. Okay? We have talked about people wearing high heels, especially the females. So if you are wearing high heels habitually, every time you go to work, out of fashion, you wear high heel all the time, you are putting your ankle, your knee, your hip, your low back in so much stress. So at later age, it will not be surprising that any of these joints will begin to manifest features of osteoarthritis. Okay? What we eat doesn't matter. Yes, what we eat matters. There are certain foods that are encouraging inflammation, what we call as encouraging acidity of the body. And by rule or thumb, is actually those foods that are passed through processing, that are passed through one processing method or the other, what we call junks. So by this side of the screen, you see all this food, and you can see that all of them have been processed. This is processed meat. It's a meat, but it's a processed one. You know, dairy, eggs, plenty of it for an adult is not good. You know, our junks, meat pies and all that, you know, soft drinks, all these things are not, they cause high acidity of the blood and encouraging oxidative process. And as we know, arthritis is an oxidative disease. So when you're taking this type of food, you're encouraging destruction of the joint tissues and the joint and the body in general. Healthy food are these ones. If you look at them very well, they are natural food products, and they are majorly plant-based. So if you want to live healthy, among all these things, please add water. Let there be plant-based food on your menu on daily basis. Okay? Right. Dehydration does not taking enough water, does it cause arthritis? Yes, just like those food we mentioned earlier on that encourages inflammatory process, dehydration also encourages an inflammatory process in our body. In fact, it is said that 3 out of 5 people, especially in the tropic zone, don't drink enough water. You watching me might not be drinking enough water. And what should be enough water for you? In the tropical environment, you should not take less than 2.5 liters of water every day. All the water intake you have should not be less than 2.5 liters. And many of us don't even go halfway. Okay? So, if you are not hydrated well, so dehydration promotes inflammation and arthritis, and with high blood, with other problems it causes. In fact, research has shown that not taking enough water or dehydration is the foundation for many diseases we suffer. So if your blood is in alkaline state, it encourages healthy life. Okay? All right. So the last time we talked about activities of daily living, things we routinely do that might be predisposing us to arthritis. So if you have not watched that lecture, I will encourage you to go and watch that lecture because we mentioned a whole lot there. So wrong posture, the way you sit, what we call slouching, sleeping position, sleeping mostly with your tummy, which puts stress on your lower back, carrying heavy objects in a very wrong position, bending over and lifting things up, putting stress at your lower back, and all the sedentary lifestyle, not exercising, all these things we do without minding cause arthritis. I thank you for watching, and I encourage you to subscribe to our channels so that you'll be getting more lectures, more videos like this, because you might learn 1 or 2 things that will help you. I will also encourage you to share to your friends, because we need to know, as he said, my people perish due to lack of knowledge. Thank you very much.